The micro responsible for causing a style infection. The micro style infection is generally identified as a better suggestion. Many students, you are not getting it. Make a better suggestion. Style infection is caused by style infection is caused by your answer. Infection that affect the eyelid margin and results in a painful swollen lump is medically known as a localized infection that affects the eyelid margin and results in a painful swollen lump is medically known as. If you choose A, cataract, you are wrong. If you choose iritis, then another name for hodiolum for students, wonderful students, tie. For number 6, it is a patient typically presents with symptoms such as painful swelling, redness, and tenderness of the eyelid. Can viral brain disease? C, heart condition. D, a present with symptoms such as painful swelling, redness, tenderness of the eyelid, and this can be described as A, viral, C, heart conditions, and D, lung infection. So what is your answer? Like, if you had chosen A, you are wrong. If you But if you had chosen B, bacteria eyelid infection, you are correct. You are correct. Why? It's connected to the that affects the eye. Accumulation of pus of pus. So if you had chosen C, you are wrong. If you had chosen A, you are wrong. If you had chosen D, you are wrong. The right answer is B. So this tie is as a result of what? Dead white blood cells and bacteria. Are we together? Though I will still explain in the Telegram group a well simplified class, but I want you to make first attempt to. I want you to make first attempt so that you will, if you fail it, you learn it and learn the corrections. Are we together? So whenever you hear of the word pause, whenever you hear the word style, it has nothing to do with the brain. It has nothing to do with the lungs. It has nothing to do with any other part of the body but the eye. But the eye. Are we together? This class will be more simplified in the Telegram group, but let's continue. So is an accumulation of pus as a result of dead white blood cells and bacteria. Now, number 10. Number 10, listen. Number 10, one of the major risk factor that can likelihood of that can increase the likelihood of developing a style infection is? Are we together now? Can one of the major risk factors that can increase the likelihood of developing a style infection is B. Poor eyelid hygiene. We have C. Regular exercise. D. Balanced diet. Every student should know, so I won't tell you the answer to this. Number 11. A style primarily affects which structure in most clinical cases? Affects which structure in most clinical cases? A style primarily affects which part of the eye structure in most clinical cases? We have A, the eye, the retina, we have the optic nerve, we have the lens. Which part of the eye structure does this style affect? Which part of the eye structure does the style affect? So if you choose, if you choose retina, you are wrong. If you've been following the class, you should not choose retina at all. If you choose optic nerve, you are wrong. If you choose eyelid margin, you are correct. So for being in tonight's class, whenever you see the word style, the first thing that should cross your mind is that it is a bacterial infection that affects the eyelid margin. Are we together? Now, quickly, I want us to dive into the next question. The application of warm compress in the treatment of style is mainly aimed at helping to A. Freeze the infection, B. Promote drainage of pus, C. Improve eyesight, and D. To stop blinking. The application of compress in the treatment of style is mainly aimed to, of course, C. Improve eyesight, and D. Stop blinking. This is a very simple question. So write the answer down. You will send it to me on WhatsApp. Now, 13. A style is medically described as a condition. This question comes out very well in exam. A style is medically described as a condition that is usually A. Painless and chronic, for and acute bacterial infection. C. Degenerative eye disease, and D. Congenital. So drop your answers fast. A style is medically described as a condition that is usually A. Painless and chronic, B. Painful and acute bacterial infection, C. Degenerative eye disease, and D. Congenital disorder. So drop your answer. I'll give you. I want you guys to think very well in this question, this number 30. Think very well. I'm giving you a 30 seconds to think. A style is medically described. Don't choose randomly, because this question, this thing that we are discussing about this condition, think very well. A style is medically described as a condition that be painful and acute bacterial infection, C. Degenerative eye disease, and D. Congenital. I'm impressed with the messages I'm receiving. Now, if you choose congenital disorder, you are wrong. That's not the right answer. If eye disease, you are wrong for, and it is caused by bacteria. If there is nothing that you are going home with today, don't forget this disease condition style. Iritis. Iritis is the inflammation of the iris, which can lead to a lot of light. It's not affecting any other organ but the eyelid. It affects where the eyelid, and because of it affects the eyelid, it is painful. There are some disease condition that is painless. When it affects the eye, it is painless. But one thing that makes style a unique disease is that it is painful and it is an acute bacterial infection. Are we together? So, this recurrent style infection may likely have underlying issues such as A. Strong immune system, B. Poor hygiene or reduced resistance, C. High blood pressure, and D. Good nutrition. This, I believe you know the answer. Now, 15. Now, let's dive into the next disease condition of the eye. The next disease condition of the eye. Now, let me ask this question. Let me know if you've been following. Number 19 primarily affects the A. Eyelid glands, B. Brain, C. Liver, D. Heart. So if you see such a question in your nursing council, what do you think would be the right answer? The right answer is what? Brain. Very wrong. Liver. Wrong. Heart. Wrong. The answer is a disease condition, a bacterial infection that affects the eyelid. Are we together? Now look at this question, number 20. Painless. Remember, style is painful. Now, number 20. A painless, slow developing lump in the eyelid that forms over several weeks is most likely caused by blood tear ducts. B. D. Cornea. A painless result of which gland is that? If you are wrong, if you choose D, you are wrong. The right answer is whenever there is a blockage of this myobiome, described as highly contagious, highly contagious, D, always accompanied by fever. Now let's see those that are following the class. I'm so impressed. I'm impressed. Now